Autism Spectrum Disorder, or ASD, is a neurodevelopmental condition that affects communication, social interaction, behavior, and sensory processing. Signs of autism often begin to appear during the toddler years, usually before the age of 3. And while every child develops differently, there are certain developmental patterns doctors and specialists pay close attention to when assessing for autism. One of the earliest signs can involve communication delays. For example, a toddler may not babble, gesture, or use words as expected for their age. Some children may have very limited speech, while others may lose words or skills they previously used. Doctors also look at nonverbal communication. For example, does the child point to show interest? Do they wave goodbye? Do they bring objects to caregivers to share enjoyment? A lack of these social communication behaviors can sometimes be an early sign of autism. Another important area is social interaction. Toddlers with autism may not consistently respond to their name. They may avoid eye contact frequently, or show less interest in social games like peekaboo or interactive play. Some children may prefer playing alone most of the time, or appear less aware of people around them. It's important to understand that autism does not mean a child lacks emotions or attachment. Many autistic children are loving and connected to caregivers. The difference is often in how social communication develops and is expressed. Repetitive behaviors are another key sign specialists assess. This can include repeated hand flapping, rocking, spinning, lining toys up, or becoming intensely focused on specific objects or routines. Doctors also evaluate sensory processing differences. Some toddlers may be extremely sensitive to sounds, lights, textures, or clothing. Others may actively seek sensory stimulation, such as spinning, climbing, crashing into furniture, or touching objects constantly. Strong distress during changes in routine can also be an important sign. For example, a toddler may become extremely upset if daily routines change unexpectedly, or if familiar objects are moved. Now, one very important thing to understand is this: no single behavior alone confirms autism. Many toddlers may show one or two of these behaviors occasionally. Doctors look at the overall developmental pattern over time, especially difficulties involving communication, social interaction, and repetitive or sensory behaviors together. Screening tools such as the MCHAT are often used between 18 and 24 months to identify children who may need a more detailed developmental assessment. If concerns are identified, a child may be referred to specialists such as developmental pediatricians, speech and language therapists, occupational therapists, and early intervention is extremely important. Research shows that children who receive early support often make significant progress in communication, emotional regulation, learning, and daily functioning. It's also important to avoid misinformation online. Autism is not caused by parenting style, affection, vaccines, or too much screen time. Autism is a neurodevelopmental condition with strong genetic and biological factors, and autism exists on a spectrum. Some autistic children have significant support needs. Others may have advanced language, strong intelligence, and fewer visible difficulties. Every autistic child is different. So if you are noticing persistent developmental differences in your toddler, the best step is not panic. It's evaluation. Early assessment does not label a child negatively. It helps identify what support, if any, may help them thrive. And whether a child is autistic or not, early understanding and support are always beneficial.